Good morning, and I'm Michael Erickson. I'm the Dean of the School of Public Health, and we're incredibly excited to have a full house today to celebrate our graduates. It's a very, very special day each year. It is really remarkable to see the size of the audience and the number of graduates and the families and friends grow to the point where we've now, for the first year, outgrown our space, and we have a satellite location where people can view the ceremony. That's how much our program is growing in terms of graduates and students and the folks who are here to help celebrate their success. So it's a very heartwarming and encouraging event today. I know it means a lot to all of you, to the graduates who have labored and hopefully in ways they never expected they would, and have had, the reason they're here, they have had success in accomplishing their challenges, and to the parents and friends who are here to celebrate the pride that you have for the accomplishments of your children are something that will stay with you for a long time. This past weekend, I had my youngest son graduate from college, and I didn't know whether that would ever happen or not. So I can share your pride and relief that you can begin to see them becoming independent and on their own, and bringing in their own money, helping pay back the investments that you all have provided over the years. So it's a very, very special day. We have, I think, a very exciting program. I feel strongly that commencement events are about the students. So you're going to hear primarily about students, from students, and student accomplishments. We also will be conferring the degrees today to our master's students, and we'll tell you a little bit more about the other degree students. But I'd just like to start by making a few remarks on how excited we are to have the students go forth into a public health career and Georgia State University and the School of Public Health, and that this is a very important and exciting time. The university, I've been here since 2002. The university has changed dramatically in that time in every regard in a positive way. Just this year, since last time we were in this room, the consolidation between Georgia State University and Perimeter College has succeeded. That Georgia State University has gone from a 30,000 student body to a 50,000 student body. It's now the largest university in the state of Georgia, one of the 10 or 12 largest in the nation. And it's not just size, there are locations around the perimeter where students can take courses. And most importantly, there's this pipeline concept that students in associate community colleges can then systematically go into baccalaureate programs and hopefully beyond that in a seamless fashion to really have a pipeline of higher education. And that's one of the new things the university has done. And then just even more recently, the Georgia State has acquired Turner Field, the Turner Field property, 77 acres. The first football game played this past fall in now Georgia State Stadium. Friday night, hopefully you'll be able to, the undergraduates particularly, join the undergraduate commencement at Georgia State Stadium, the old Turner Field. We had our first ceremony last night, and it was quite spectacular. The stadium is beautiful. If you haven't been there, it's now a football stadium for the Georgia State Panthers, who won their first bowl game this past winter. So a lot has happened over the last year at the university in terms of growth and recognition. But the most important part of that is that the university has been nationally recognized as a place for student success. And it's one of the few universities in the country where students, regardless of any socio-demographic characteristic, whether it's race or gender or ethnicity or income or age graduate at the same rates. And this is something that the university is incredibly proud of and has gotten the attention of foundations around the country, including, if you see on the monitors outside, Bill Gates holds up Georgia State as a model of higher education in the United States, where people can graduate regardless of their color or race or income. And that the university is a place for student success. And we really feel good about that excelling. And at the same time, the student successes excel, our research activities have excelled, which is really unusual. Georgia State's a research university, and over the past 5 years, our external funding has doubled from $70 million to over $140 million. And to have success in graduating students, regardless of their demographics, and doubling the research portfolio, no other university in the country has really done that. And so we're extremely proud to be part of Georgia State. The School of Public Health similarly has progressed over the years very nicely. We won't go into all of the details, but simply to say today we will be recognizing, and tomorrow night they will be receiving the first undergraduate public health degrees in the history of Georgia State University. So, we started as a strictly graduate program, offering the MPH program. We had our first MPH graduates in 2006, and I can tell you there were 4 in our commencement, and the room was quite not this large. And over the years, we've expanded our graduations to not only the MPH degree, the Master's of Public Health degree, but then we expanded to the PhD degree, and we have PhD awardees today that already have their degrees conferred. And this year, we'll have our first undergraduate, our first Bachelor of Science graduates. And then just recently, 2 weeks ago, the Board of Regents approved us to offer another doctoral program, what we call a Doctor of Public Health, which is intended for public health practitioners and leaders who want to pursue their education, but not with this heavy emphasis on research and more on executive leadership and management. And that program will begin in the fall. So our academic programs have built out extensively, and people say, when are we going to stop? And I think we have the portfolio of degrees now that we want to have as an accredited School of Public Health. We are talking about looking down at perimeter college and community college and what we can do to get people who are starting their careers thinking about public health as well. Because public health is a very exciting field, and one, I'll just conclude my remarks by saying that the reason we are here, I mean the employees, the faculty, the staff who make today happen, is because we really are committed to advancing public health. And public health is a very special career. It's one that I wish my sons had followed in my footsteps in a public health career, but they decided they wanted to make money instead. I can't criticize them too much for that. But what we do in public health is richer than money. It makes a difference in people's lives. And you can talk to our faculty, and I hope you do afterwards, about the work that they do, how they make a difference, how they help, how it's not a clinical endeavor where they treat individuals. It's a focus on populations and groups to avoid preventable disease and death and mortality. And in my career, I've spent my entire career in public health, I never imagined that the challenges would be increasing as opposed to decreasing. So if you think about what your kids are going to do when they graduate and go out, I don't know anyone can predict, but the needs are there. Yesterday, you probably may have seen it in the news, there was a new Ebola outbreak in the Democratic Republic of Congo. There's already deaths. diagnosed cases. No one knows where that's going to be going. A year ago, we wouldn't have been talking about the opioid crisis in the same way we're talking about it today. And so challenges persist, new ones come up, and they really all require a trained and committed and dedicated workforce. And that's who we have here today. So let me close my remarks by just saying thank you for supporting your children, okay? We don't call them children to their face, but they're young people. But the parents in the room have had to understand what public health is, so you really want to go back and get another degree, want to go out and work. And these people in front of us are going to be the future of public health, and there really isn't a better place to do that, in my opinion, to get trained at Georgia State and then to work in Atlanta, where there are institutions here that exist nowhere else in the world. And so I think your students, graduates, you're well placed, you're well trained. We wish you the best of luck, and Rodney, I'd like you to go on with the program. So I'd like to introduce Rodney Lynn, who will start to introduce some of our student speakers.
Good morning. It's my pleasure to introduce our student speaker this morning. Hazel Shaw is graduating with a Master of Public Health degree with a concentration in biostatistics and a grade point average of 4.02. Our capstone is entitled Understanding Open Access Data Using Visualization in R. Throughout our program, Hazel has served as a member of the Student Affairs Committee in the School of Public Health. She's worked as a graduate research assistant with Dr. Betty Lai, as a project lead for a grant funded by the National Science Foundation, and she's also worked on a project funded by the National Institute for Mental Health. While working as a graduate assistant, Hazel has been the first author on a published article entitled Undergraduate Research, a Valuable Experience for Expanding Your Mind and Resume. She's been co-author on one manuscript, as well as one peer review and another published article. She's authored and presented posters at the Georgia Public Health Association and the American Public Health Association conferences. In addition to all of this, she's a contractor for the Georgia Department of Public Health, serving as a maternal mortality epidemiologist and data manager. Hazel has accepted an ORISE fellowship with the CDC to work as a surveillance epidemiologist and data manager for the FoodNet team and the National Center for Emerging and Zoonotic Infectious Diseases. Please welcome her.
So welcome, graduates, family, friends, and faculty to the Spring 2018 School of Public Health Commencement Ceremony. I know I'm not the only one who's relieved that this day has finally arrived. For many of us, we have spent a couple of long years dreaming of this moment. As I look around the room, I see many familiar faces. Most of us have shared multiple classes and some rather interesting experiences together. Over the past couple years, we have persevered through some of the most challenging and sometimes frustrating courses. Throughout our curriculum, we studied John Snow and the famous Broad Street waterfront. We identified the numerous levels of the socio-ecological model. We learned the importance of specificity and sensitivity, and we analyzed how healthcare differs throughout the world. Although we all studied the same material, there were a few of us whose paths did not cross. However, whether or not we have personally interacted, I feel as though I know you. I know that we have all come here for the greater purpose that is public health. We all care about those around us, and we came here wanting to learn how to create a safer and healthier world. Whether we hope to implement change by informing policies, promoting healthy behaviors, or assessing exposure, whether we conduct case control experiments or analyze them, we all aim to make a difference. I would like to take a moment to specifically address our family and friends. First of all, I want to thank you on behalf of the graduates. I want to thank you for those of you who have supported us throughout this process. Without you, we would not be the champions of public health that we are. I also want to share with you why we are here, why the graduates and faculty assembled are so passionate about public health. I promise you, it's not because of the money. According to the CDC, public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. This is what we care about. But why? It's because the residents of Flint, Michigan have not had consistent access to drinking water since 2014. Because millions of people are infected by HIV, hepatitis, malaria, and tuberculosis each year. Because 1 billion people lack access to healthcare systems around the world. Because if we won't raise our voices and incite change, who will? This is why we care. So graduates, you are all now masters of public health, and you have the opportunity to take action and to start a movement. We have graduates here from a variety of backgrounds and cultures who have witnessed a multitude of healthcare systems and have decided to take it upon themselves to make an impact. We are the generation that will make a difference in our communities. It is our moral imperative to give everyone the right to good health. I think Frozone from The Incredibles said it best when he said that it's for the greater good. We don't just want to treat the individual, we want to help the world. And we can. Whether you work with a local, state, or national government, whether you volunteer in a different country as a fellow or scholar, whether you pursue a career in academia, you will have an impact on everyone around you. I encourage you all to think about what motivates you, and to use that motivation to create a healthier world for us and our future. So congratulations, class of Spring 2018 School of Public Health graduates. Let our movement begin.
Thank you, Hazel. That was as good as a professional commencement speaker address I've seen, so thank you so much. As I said, we really want to have this ceremony highlight the students and their accomplishments, and we have a special guest next. There's a program that Georgia State adopted last year. It's called the 3-Minute Thesis. And this is a project that started in Australia, and it was a competition where around the world students would compete at their university to present their research in 3 minutes with one slide. And they'd sign up, and it was like Jeopardy. You would have to go to a room, and people would judge you, and they would wean out the finalists. And last year was the first year it was done at Georgia State, and one of our public health students, our Masters of Public Health students, won the 3-Minute Thesis Award, and we were incredibly proud of that. This is the second year it's been done at Georgia State, and I'm absolutely delighted to say that the Masters of Public Health student once again won the 3-Minute Thesis Award. So what I'd like to do is invite Johnsel Stevens to the podium to present to you her 3-minute thesis. And any of you can time it if you like. Last time she had it down to 2 minutes and 57 seconds. So Johnsel, please join me.
A pressing public health issue surrounding prenatal care exists in our nation and especially in the state of Georgia. Between 2015 and 2016, more than 7,000 babies were born to a mother who would not receive prenatal care. According to the March of Dimes, in 2016, Georgia was ranked 8th highest in number of preterm births. And according to the CDC, Georgia is currently ranked 5th in number of low birth weight births. These are lists that we do not want to be at the top of. Research has shown that prenatal care offers positive benefits to a mother and her infant, so why are so many women in Georgia going without this important care? Researchers have found a list of factors that affect a woman's decision to seek prenatal care and the quality of care that she receives. Despite knowledge of this long list of factors, a gap exists when we discuss prenatal care specifically in Georgia. My research will close this gap by identifying factors that are specific to women who live in our state. My research is based on a unique data set from the Georgia Department of Public Health, and it contains information on these mothers that did not receive prenatal care and the infants resulting from those births. My research will identify characteristics such as mother's age, race, ethnicity, her highest education level, as well as the funding source she used to pay for the delivery of her infant. With this information, we'll be able to know the target population of women who are most likely to go without prenatal care. I will also look at rates of preterm birth among urban and rural mothers in the state of Georgia. Knowing where birth outcomes are the worst will give us information on where prenatal care resources are most needed. In all, a reason why a woman might not receive prenatal care is a multifaceted issue, so it would require multifaceted teamwork. My hope is that my thesis will open a dialogue among those working in maternal and child health, epidemiology, health promotion and communication, and obstetrics and gynecology, that they may put their minds together to come up with practical solutions to this pressing public health issue. Thank you.
At this time, I want to move us into the awards portion of our program and recognize our award recipients for the 2017-2018 academic year. Every year we take an opportunity to recognize our outstanding graduates, and this is an opportunity to recognize those that have gone above and beyond in their commitment to either the School of Public Health or to the broader community. This year we recognize 3 students. The first award is the Public Health Student Achievement Award. This award is given annually to an MPH student as well as a PhD student in recognition of their outstanding academic performance, scholarly contributions to the field, and service to the community. Our first awardee is Rebecca Wells. Rebecca is graduating with her PhD, a concentration in health services research. She's a Second Century Initiative Fellow in health disparities in developmental disabilities, and has been a research assistant for 4 years in the Center for Leadership and Disability. For the past 3 years, she served as co-instructor for a university-wide undergraduate course, Perspectives 2001, the Experience of Disability in America, with her advisor, Dr. Dan Crimmins. She was the first SPH doctoral student to serve as instructor of record in our undergraduate program. In that program, she taught the course Fundamentals of Health Policy. And in addition to that, she's also served as a student representative on several School of Public Health committees, including our Space Committee, the Academic Affairs Committee, the Workforce Development Committee. And most recently, Rebecca proposed and delivered a 2-day course on health policy for CDC University with me. So I've had the opportunity to see her in action, and she's an exceptional instructor. She successfully defended her dissertation this spring, the title being The Impact of Medical Home on Outcomes for Children with Special Needs, Special Healthcare Needs. This summer, Rebecca is going to join the faculty at the University of Georgia as clinical assistant professor. She's jointly appointed to the School of Public Health there, as well as the School of Social Work. Rebecca, would you come join me on the stage? Our second awardee is Caitlin Pierce. Caitlin is graduating with a Master of Public Health degree, concentration in environmental health. Her thesis is toxicological assessments of released engineered nanoparticles from aerosolized products on human small airway and bronchial epithelial cells. Wow. She's worked as a graduate research assistant with Dr. Krista Wright. She's been an intern for the Environmental Protection Agency's Superfund Scientific Support Section. She was a recipient of the 2007 Georgia Environmental Health Association Graduate Scholarship based on her academic and laboratory achievements. Caitlin, would you join me on the stage? Our second student award is called the Diane Caves Memorial Award. This award is named after Diane Caves, a Georgia State Master of Public Health student who was tragically killed in the 2010 Haitian earthquake while on assignment for the Centers for Disease Control and Prevention to work on the President's emergency plan for AIDS relief. This award is given annually to the student who best exemplifies the selflessness and dedication of public health that Diane exhibited. This year's awardee is Diamond Miller. Diamond is graduating with the Master of Public Health with a concentration in health promotion and behavior. During her time in the MPH program, Diamond has worked as a graduate research assistant with Prevent Child Abuse Georgia. She served as Vice President of the Public Health Student Association, served as a community leader for the Truth Initiative, participated in the Advanced Childhood Experience Training with Dr. Shanta Dubé, and she's also attended the Emory School of Law Child Advocacy program training to continue her increasing her knowledge on child abuse prevention strategies. Diamond, would you join us on the stage? To our practicum awards. Today is a day to celebrate the achievements of our students primarily, but we recognize that we can't do this work alone, and we really need public health partners in the broader public health community to support the professional development of our students. And so today we'd like to recognize our community partners who have helped mentor, support, and promote our students. Our first award category recognizes the Practicum Preceptor of the Year. These recipients were nominated by our students and chosen for their outstanding mentorship and leadership in a public health practicum. The School of Public Health would like to recognize Erica Sheldon from the School of Public Health. Ms. Sheldon, would you join us on the stage? Our next award is one that recognizes a public health organization for its demonstrating commitment to our graduate students in public health and its continued support of practicum opportunities. This year's recipient is the Centers for Disease Control Prevention Division of Global Migration and Quarantine. Accepting the award today is Dr. Nina Morano and Dr. Annalise Donnie. Please join me in congratulating them. Please join us on the stage. To conclude our awards, we have 3 faculty awards, and I'm going to invite the chair of the Faculty Awards Committee in the School of Public Health, Dr. Jiang Wang, to come to the stage and present those awards.
Thank you. So today we celebrate the success of our students. The success of our students is also due in part to the exceptional service and instruction and teaching from our faculty. So we use this opportunity to recognize some of our faculty members who made exceptional commitments to our students, to our school, and to our community. So this year, we're going to give 3 awards. The first award is the Exceptional Service Award. This award is to recognize the excellence in service by a full-time School of Public Health faculty member. And this year, the award goes to Dr. Shannon Self-Brown. Dr. Self-Brown is the director of our PhD program in School of Public Health. She is the go-to person for our MPH and doctoral students. And she is beloved by our students, and she serves on numerous committees and serves the school and our community with dedication. So congratulations, Shannon. Excellence in Instruction Award. And this award recognizes a full-time faculty member in the School of Public Health for outstanding achievement in instruction and teaching. And this year, this award goes to Dr. Sherry Strasser. Sherry has received consistently high teaching evaluations from our students, and she's beloved by our students. Congratulations to Sherry. The last award is the Outstanding Faculty Award. This award is given to faculty member in School of Public Health in recognition of the superior accomplishment in research, teaching, and service. And this year, this award goes to Dr. Ashley Owen Smith. Okay. So thank you.
It's my pleasure to introduce our alumni speaker. Dr. Nataki Osborne-Jelks graduated from the School of Public Health in 2016 with a Doctor of Philosophy in Public Health. Her dissertation was titled Combined Environmental and Social Stressors in Northwest Atlanta's Proctor Creek Watershed, an exploration of expert data and community knowledge. Today, Dr. Jelks is the chairperson of the West Atlanta Watershed Alliance and a visiting professor of public health at Agnes Scott College. Her research interests encompass environmental justice and environmental inequality, cumulative environmental risk and impacts in urban communities, the health impacts of climate change on low-income and communities of color, sanitation, wastewater infrastructure and policy, green infrastructure, food access, justice, and food insecurity, as well as connecting to nature as a tool for health promotion. She continues to work in the community to improve the quality of life for those living in West Atlanta. Recently, Dr. Jones was appointed to the U.S. Environmental Protection Agency's National Environmental Justice Advisory Board, which provides advice and recommendations to the agency. She also received Spelman College's Local Community Service Award for engaging urban communities and youth of color in environmental stewardship, education, and training. Please welcome her to
Good morning. Good morning. To Dr. Michael Erickson, Founding Dean of the Georgia State University School of Public Health, Dr. Rodney Lynn, Associate Dean of Academic Affairs, other administrators, to the committee that planned today's convocation, faculty and staff. Thank you for extending this gracious invitation to share with me on today as we celebrate an important milestone in the personal and professional lives of the class of 2018. And to the graduates, I remember where you are well. In fact, I was in your shoes and sitting in those seats just 2 years ago, excited, proud, relieved that I made it through, that I passed what I thought was the final test. I successfully defended my dissertation, and I even accepted a job already that I was elated about. Reflecting back on all that that day meant to me, I salute and celebrate you for your amazing accomplishments on today. Like I and my fellow graduates in 2016, many of you are likely exhausted and exhilarated at the same time. You have made personal sacrifices, and for many that extends to your family members. And you might even have a family member or two who feel like they have invested so much in your journey that they should walk across the stage and earn a degree on today as well. So today, filled with emotion and joy, all of the late nights at home, in the library, in the School of Public Health graduate cubicles, working on group projects, running and analyzing regression analyses, preparing for class discussions, refining research designs. Today, the late nights and early mornings, the balancing act of school, of work, and family, they end triumphantly with a reward. And I hope that for all of the sacrifice and perhaps struggle that you've gone through, that it was actually worth it. So I'll keep my message brief, because I understand my positionality. I know that I am the one thing standing between you and the official proclamation of the title MPH beside your name. And I know that the doctoral students have, or graduates, have already had their degrees conferred. But while I have this moment and this platform, I want to offer to us all a friendly reminder that I hope will both encourage and challenge you. And it's simple. See the needs of our communities, have compassion, and do something about it. Many of us came to or even migrated into public health because it was in it that we could find purpose. Whether our passions lie in tackling intimate partner violence, developing interventions that engage hard-to-reach or vulnerable populations, or understanding the upstream determinants that lead to poor health outcomes in urban or rural communities. For most of us, there was a single common denominator that brought us to public health, and we've already heard it today. We wanted to make a difference. And I'm just here to encourage you to stay on that course. In the current societal context and political climate in which we find ourselves, important public health priorities, affordable health care, clean environments, equity and social justice, even science itself are under attack. But science, truth, ethics, social justice, and equity should be non-negotiable tenets of our work as public health professionals. If we intend to reduce the gaps and perhaps even eliminate health disparities, then it may require that we challenge the status quo. It might make it necessary that we even speak truth to power. You may be thinking, well, I'm a health educator, I'm an epidemiologist, or even a statistician or a bench scientist. Even so, don't be afraid to embrace your roles as public health advocates. No matter where wherever you find yourselves, in government, academia, with an NGO, consulting firm, or even a policy think tank, find a way to push the envelope, to insist that failure is never an option, to hold high the banner of health equity, acknowledging that health is a basic human right. In a few minutes, we will all be fellow alumni of this institution in downtown Atlanta. This School of Public Health with an urban focus and a global reach. And since we will collectively have or carry that designation, we don't get a pass when we see communities suffering, or when we see vulnerable segments of our population in need. And not only that, not only do we not get a pass, we have an obligation to do something about it. We must use our passion, our training, our expertise, and even our privilege to challenge and to dismantle structural inequalities, to elevate the stories of vulnerable populations, to conduct the research that nobody else is conducting, but that can shape the narratives and lead to investments and advancement toward healthy, whole populations everywhere. When we hear incorrect stories, we must use data and evidence to challenge and to correct them. When the plight of those who are most at risk are marginalized and their voices are silenced, we cannot be bystanders. We have to elevate those stories, amplify those voices, and bring them from the margins to the center. If the goal of public health is to protect and improve the health and well-being of populations through the art and science of preventing disease and promoting population health, then we have much work to do. From the west side of Atlanta to West Africa, you are needed to make a difference. And whether it's smoking cessation, promoting healthy sexual behaviors, addressing chronic disease, or even ensuring clean drinking water that gets you up in the morning, know that we have no one else to look to. You are the leaders who we've been waiting for. And you are ready. You know how to identify, measure, and compare health outcomes and how to analyze big data. You know how to design health interventions grounded in sound theory and evidence-based practice. Your time has come, and you have a contribution to make. You have been prepared by the best faculty in the entire world, not only to carry out the basic functions of public health in our society or to conduct innovative research, but you have been equipped to be leaders. See a need, have compassion, and do something about it. But first, on today, celebrate. Congratulations.
So I asked that I not have to come up after Nataki's speech, but maybe I think we can get Nataki to write our speeches, but more than that, to deliver them. We'll be successful. It does bring a tear to my eye to see the talent and the competence that are coming out of this program and going out into the world to make a difference in ways that we cannot even begin to imagine. So Nataki, thank you again. So now we go to the official part of the commencement. I'll just make one remark. This is the first year we have three different types of students here present. We have the MPH students who will actually, in a few moments, get their degrees officially conferred to them. And I will ask the MPH students to please stand now. We also have BS students and PhD students that will separately, but the BS students will have their official degrees conferred tomorrow night, and the PhD students had their degrees conferred last Monday night. So this is a special moment for our MPH students. This is our largest class of MPH students, and I have to say, the greatest of pleasures to grant to you, by virtue of the authority delegated to me by the President of Georgia State University and the authority vested in the President by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official records of these commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. Congratulations, graduates. Conferring the degree, please move your tassel from the right to the left. So I'd like to ask the BS graduates to stand as well, and the PhD students, and then we will all proceed up to the stage for congratulations. So again, folks, join me in congratulating all of our graduates.
Good morning. So I know this is the part that everybody's here for, the reading of the names and the marching of the students.
All right.
So I'm very excited. I just want to say before everybody gets started that congratulations to this class, our largest MPH class. This is just amazing. As Dean Erickson said before, we just had 4 MPH graduates that first time. So this is absolutely amazing. And so graduates, if you will follow the lead of our staff, and we can come on up, give me your name cards, and I'll read your name, and we can have officers. Akane. Catherine Arce. Abdullah Tambura. Asha Bell. Diana Bonilla. Eva Lushna. Orpa Bosara. Carter. Adore Shorty. Leafy Chelsea. Taylor Diaz. Simone Dumas. Junior Litchi. Sharon Ephraim. Logan Endebach. David Franklin. Dorian Freeman. William Garvey. Madison Gilbert. Lola Green. Samara Clary. Bakari Gresham. Tyler Taylor. Marissa Hicks. Jeffrey Michael Holiday. Megan Jackson. John Giant. Sophia Johnson. Michael Shottree. Commissioner Lawler. Sensei Mckesson. Commissioner Buster. Tara Martin. Alantine Gill. Seth Manor. Linda Mahari. Allison Mine. Diamond Miller. Alexander Mitchell. Abigail Montero. Danielle Moore. Sonia Nolly. Nancy Nolly. Marsha Wheeler. Brianna Oliver. Olumide Osikalabi. Caitlin Pierce. Janae Carey. Adriana Potts. Caitlin Ross. Zachariah Rolla. Ashley Sam. Sandra Simo. Christine Smith. Megan Smith. Kalugi Sorrow. Abigail Sparrow. John Stevens. Natalie Stern. Lucian Frazier. Rachel Thomas.
Love you, Daisha!
Joey, Joma Uzuzi. Aaron Vincent. Grace Winienko. Isa Zamora. Jeremiah Williams. Kelly Shumay Williams. Now we have the PhD recipients, Dr. Jamal Chai.
All right.
Ashley Collins. Amanda Grant. Kathy Ho. Jacob Kibede. Taylor Hill. Taylor McKinney. Uba Muhammad. John P. Patel. Jessica Rogers. And Darlisha Williams.
Please, everyone have a seat. This is, as I said, this is the first time that we've had all of our undergraduate and PhD and doctoral students together. It's a very memorable event in the evolution of the School of Public Health. I'm very very exciting and positive one, and we look forward to many future years and adding in new degrees as we go forward. Obviously, I don't need to say that I think all of the students know from their experience here that this is a lifetime relationship, that we are available to work with you and help you as you go forward. We're not asking for money. We're asking for a relationship. We want to be available for us to help you and for you to help us. And one of the things that's been most heartwarming for me over time is to see our alumni hire new alumni and help them, and mentor them, and give them opportunities to succeed. And that's now part of your responsibility as you go forward in your careers to look back at the university and how can you help fellow new students, new undergraduates, new MPH students, for them to be successful. You can open doors, you can mentor, and you can make a difference in a different way than you have in the past. So that's what we're looking for in terms of a lifetime relationship. And whatever we can do to advance you and help you, provide letters of support and recommendation, and hear your ideas, please stay engaged because we're very sincere about that. Let me just make a couple of closing comments. First of all, none of this at all would be possible without the incredible faculty and staff at the School of Public Health. So I'd like all the faculty and staff to please stand. I think you all know, not just for a day like this, what it takes to organize it, but for a degree to be conceptualized, delivered, and graded, and awarded, and to be inspired, and to begin to understand where your passion is, and what you want to do, and wherever you want to make a difference, begins with the faculty that you get to know, and that they will be available to you, and you to them. So do maintain that relationship. The last thing I'd just like to do in closing is to once more congratulate the graduates and the families that are here. So one of the things that the president does is notes that the graduates aren't here just by their own effort. They are here because of the perseverance and patience and money and support of your family. So graduates, let's thank the people who have